And good evening, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. As we discuss the writing session like once or twice in 2 weeks, and today is the day we always discuss about a writing session. So, because there is an exam that is coming up, so again, the last time it was a kind of a referred back letter, and referred back letters and the discharge back letters are the most common letters. They always keep on repeating. Even now, even the coming exam might have the same kind of letter because they are the letters where you don't have to write the social history, medical history. Discharge back letter means that a patient is coming from a doctor and you have treated the patient. So he came from doctor, he came from GP, and you treated the patient, you are referring back the patient to his GP. So that means GP already knows about social history and medical history. So in the referred back letters, in the discharge back letters, you don't have to write the social history and medical history. But this is a letter that I don't know why I have that intuition that it would be a visit letter tomorrow, but this letter is also not a visit letter. That is what I am here for, to teach you today, because I was thinking that I should tell you how to write an OET letter. So this would be a perfect video to understand how to write this letter. And thanks to MedCity who has created this question paper. But my job being Dr. BKM OET Institute is to teach you how to attempt question papers. So my concentration would be all devoted to how to do a question paper. So this is a very nice question paper. Write a referral letter to Mr. Roger Williams, emergency doctor, casualty ward. So you have to write a letter to the emergency doctor. That means the doctor is basically, you have to write it to the doctor who is in the emergency department. So obviously that means the patient's condition would be very serious. St. Peter's Hospital, NSW. So I hope the screen is visible. Can you please put it in the chat box if screen is visible to everyone? Just one yes would do. Is it visible to everyone? And am I audible? Okay, perfect. Thank you. So many yes. Thank you, Jashan ma'am, Lupinder ma'am, and everyone. Thank you for responding. Okay, so I'm just gonna write it down as well for you. Okay, so suppose I'm taking this page, an extra page, and we want to know how to make an OET letter easy. I hope this screen is also visible, right? So is it visible as well? Just one more yes. This empty screen, if I write something, yeah, cool, done. Okay, guys, thank you. So I'm just going to write the whole way how you write it. So I'm just going to take it from here. So if you can say, write a letter to Mr. Roger Williams. How do you start an OET letter? That you simply write, I'm just going to make a little short to it. Yeah. Okay. Yeah, that would fine. That would be fine. Okay. So I'm just going to write the whole kind of letter. How do you attempt Mr. Roger Williams? All right. Emergency doctor, casualty, Mr. Roger, R capital, Roger Williams. That is how you will always write. Dr. Roger Williams, emergency doctor. So you just write doctor. It doesn't look nice. Emergency doctor. So Dr. Mr. Dr. Roger Williams. Let's write this. Dr. Roger Williams, emergency department, or you can write directly casualty. Casualty, St. Peter's Hospital, NSW. Okay. Casualty, St. Peter's Hospital. Again, you don't have to worry, you don't have to become over cumbersome about anything. If by chance you write emergency doctor, that doesn't mean that they will fail you. Please don't take it that way that they will fail you. But my understanding says when I have written doctor over here, so I don't want to write this. And casualty obviously means he's in the emergency department. So that is why I did not write it as per my understanding. So, but if you by chance write it, doesn't mean that they will fail you on this thing. They won't fail you on these things. There are many other things they look after. So NSW, so that's the first thing you will write. Then you will write today's date. So last date is today date, that is 14th March 2020. So I will write 14th March 2020. So for all the people who are listening to my videos for the first time and all the newcomers, I'm just telling you how to write. 2020, simple. Then you will write regarding which patient, what is the name of the patient? The name of the patient is Mr. Roger Macune. All right, Mr. Roger Macune. And overall you will see it will take maximum for maximum 20 minutes. If that is I have to write on notebook. It will take much less time. Age 42. That's it. Then I will say, dear doctor. So that is the way you start your OET letter. Now the first paragraph is for the purpose. So I have to write the purpose. So now I will try to find the purpose of the letter. This letter says what has happened. Purpose is always given in the last visit. So he visited community health center for the checkup, assessed and history collected, close contact with the Chinese tourist earlier, suggestive symptoms of COVID-19. So the main purpose is that patient is suspected with COVID-19 and that is why he is being referred to you. So you don't have to write everything. Even if you write only this thing, this is the main purpose, that he is suspected with COVID-19. That's it. So even if I write this way, I am writing to refer Mr. Makune, second name, M capital. Take care of small things. Akune, who is or who has been suspected. You can use either of the tenses. Who has been suspected means present perfect. And after suspected, it is always with. Who has been suspected with COVID-19. Or otherwise, you can say who is having or who has been suspected with COVID-19. Let's make it simple. Why to change COVID-19? On the basis of symptoms, on the basis of his signs and symptoms. Signs and symptoms. Therefore, he is being referred under your expertise on urgent basis. That is what under your expertise on urgent basis. So you are telling that is the main purpose, that why are you sending the patient? We are sending the patient because he is suspected with COVID-19. And how did we suspect? On the basis of symptoms. Because we have also assessed the patient, obviously signs would be there. If by chance you don't feel like, sir, signs are not given, again, they will not fail you over this small thing. So right, on the basis of symptoms, on the basis of his, just to make nice, on the basis of his current symptoms. That's it. It looks better now. You just, it should be in the flow. It should look nice. And that is what it is all about. So I've written, I'm writing to refer Mr. Makune. Sorry, my mistake. M capital. These are the small things you have to take care. So I'm writing to refer Mr. Makune, who has been suspected with COVID-19 on the basis of his current symptoms. Now, why I wanted to discuss this letter? This letter is very special because in this letter, the main confusion now that will happen is that you will not be able to understand whether these dates are visit or not. That is the special thing about this letter. You feel like on 9th patient visited for the first time, then on 10th he came again, but then you will realize that patient came to the community health center only on 14th, that is today. 13th he did not come, 12th he did not come, 10th he did not come, 9th he did not come. Even if he came, even he did not come, we cannot understand. So what to do in these kind of letter? Because normally we write on first visit, on first visit. But in this, when patient has not visited, what will you do? Let's see what will we do. So now coming back to simple things. Patient, Mr. Makune, I am a community nurse working in a community center. 42 years age patient lives in this area. Today's date is 14th March. That is what I was saying. Today's date is 14th March. So that's exactly, the time is 7 a.m. Patient visited early in the morning. So what is the medical history? Patient is having asthma, patient is having diabetes mellitus, patient is non-compliance with medication, has corticosteroid inhaler, human mixed stirred, and then had a minor fracture. So when it comes to COVID-19, that is where you need to learn data selection. It has nothing to do with fracture. Treated with open reduction, nothing to do. Bed rest for 1 to nothing to do. Delayed wound healing may be due to diabetes, but again, we don't have to mention because we are worried about COVID-19. So we are worried about asthma, diabetes, medication non-compliance, and corticosteroid inhaler. Now, the main thing I want to teach you is the grammar. So the second part, important part is grammar. Asthma 1998 and diabetes mellitus 2005. Okay, then this is the best tense for the socialist. Then when the year is given, so you will say Mr. Makune has been suffering. This is the tense that gives you marks. Has been ing because patient is suffering from asthma Even if you write this word capital or you write this word smaller, it does not make a difference because asthma is a name of the condition, so you can put it that way, but it is also not on the name of any test, so simply write it this way. So a patient has been suffering from asthma since 1998 and diabetes since 2005. Okay. Has been suffering from asthma since 1998 and from diabetes. So I'm just mixing up the lines since 2005. So that is has been ing with since and for. Present perfect continuous. That is what gives you marks. Now connectors. Medication non-compliance. So in this letter, I want to teach you two things which give you marks. First is tense, has been ing, since and for. The second is connector. However, he is on medications, but he is non-compliant. But he is non-compliant with his medications. That is how you write good connectors. So that means this but that he is on medications for these condition for these conditions mean these diseases, but he is non-compliant with his medication. So this connector, but you can also replace it with however, if you want to use a better connector. So these are the small things that give you marks. Commas, connectors. So second paragraph is done. That is how simple OET is. That you can make it very, very, very simple. Two paragraphs done. It does not take energy at all. Now the main thing. Again, everything is main. If you are writing the right things, everything is main. This is also main. Has been ing. This is also main. He is on medications. He is on medications for these conditions. Writing like this. However, he is non-compliant with his medication. Writing. And therefore, all these things are very, very important. Otherwise, OET is very simple. It's just about controlling and not doing mistakes. Now going on to, so this paragraph, corticosteroid inhaler and human mixture. If you want to write, he is on medications such as corticosteroids. If you want to write, that's not a problem. And human mixture. You don't have to get confused. Even if you write it, you do not write it. Main topic of today is COVID-19. That should be there. Now we have told that he takes these and these medication, but he is non-compliant with his medications. Now the next thing. Now never make OET difficult. He lives with his girlfriend, no family nearby, girlfriend on a business tour, chronic smoker, excessive alcohol consumption. So smoker and alcohol are very important, lives with his girlfriend, but she's away. So he is all alone. That is the main thing, that currently he is alone. Currently he is alone. So you can write directly that currently he is alone. So in terms of his social history, or otherwise you can simply say his social history reveals that he is a chronic smoker and drinks excessively. He has a girlfriend who is currently on a business tour. That is how simple OET is. Just don't write anything complicated. Again, if you do not write this line, he has a girlfriend, does not make a difference. Does not make a difference. Main things are these. Spelling mistakes should be avoided. So I have to again recheck in my exam that I do not do any silly mistake. Cortico. Okay. Done. Second paragraph done. Now, this was the main thing on ninth. Now you cannot write on first visit because in this letter, that is the main point I wanted to teach you, that you cannot understand whether this is visit or not. So when you are confused, just simply say on 9th March, he was having breathlessness around 9 p.m. in the evening. So he used inhaler and got relieved. Now, how to write? Simple. Again, I will write so simple. That is what OET is. Again, on 9th March, he suffered from. Second form, that's it. He suffered from breathlessness. Now connector. This gives you marks. Connector. Breathlessness. So he took inhalers and got relieved. That is how you write these lines. Please don't take it for granted. It is looking very easy. OET in fact is also very easy, but you have to control that. You cannot put he was suffered. To make it a passive voice, he himself suffered. That is the only thing you have to. So he took himself took inhalers and he got relieved. That's it. Why to make it complicated? So this is not a visit letter. That is what I wanted to teach you today. So 10th, he was tired and lethargic, had temperature, unable to get out of bed, so took antipyretics. Now again, see the change of connectors. The following day. Next day should be written as the following day. He had fever of 102.5 and was unable only right to get out of bed. Now connector. So he took antipyretic. Now what I can do about this connector? Please understand. So again, I'm writing so. So I will change it for which. This is a very nice connector for which he took antipyretics. Spelling, please take care. Yaar. I'm not worried about spelling at the moment, but in exams, spelling plays a very important role. So the following day, I have covered everything. Was tired, high temperature, and chills, unable to get out of bed, took antibiotic. So I missed out the word tired, lethargic, and chills. If I want to write, I would write means it is all up to. So he has fever, we can't write. It is in the past. He had fever. That is the tenses you have to control. When it is in the past, everything would be past. Suffered, had fever, took. The following day, I was unable to get out of bed. So I was talking about antibiotic. If you want to write, he had fever, tiredness, and lethargy. If I have to cut it, all right. Fever, I will write fever of 102.5 degree Fahrenheit. Done. So he had fever of this, tiredness and lethargy, and was unable to get out of bed, for which he took antibiotics. That's it. Now 11, and now what happened? After 2 days, fever got settled, sore throat, cough, breathlessness, took inhaler and got relieved. So again, after 2 days, so that is how you connect the story. Ninth, the following day 10th, then after 2 days. His fever got settled. Simple second form, don't do anything else. These are active voices, everything is happening by itself. His fever got settled, but he had, but again connector, but there is positive, he had sore throat and cough and breathlessness. So, and breathlessness. Sore throat, cough, and breathlessness. Then what did he do? So small connectors can be used again, like but I used, but in this I used but. Over here I did made it however, but even if I wanted to use but for 2 times, it was not a problem. So after 2 days, he had sore throat, cough, and breathlessness. So he took inhaler, and so he again took inhaler because this is the second line and got relieved. That's it. Now these are over 13th. So today is 14th. So yesterday, high temperature, sore throat, breathlessness, read the news about COVID-19 and became. So now you can also make 4 paragraphs. You can also make you can also make 5 paragraphs. So 1, 2, 3. I'm making 5 paragraphs. Let's see yesterday, because I think it would be better. Yesterday he had, so his fever, or he He suffered from, I have used, had, I have used. Yesterday he again, or his fever, go to 103 degree again. So that is just, I'm changing the words. Otherwise, I can simply write he suffered from fever again. His fever got to 103 again, and he read the news about COVID-19. Simple. And he read the news about COVID-19. Now I will teach you one more connector. Because of which. So because of which means due to which he became cautious. That means after reading the news, he became. So I am not using first visit, second visit, nothing. I'm making my tenses right, making it simple. His social reveals that he is a smoker. Even if I do not write that his social history reveals, you can simply say he is a smoker and drinks excessively. If that is not looking nice, you can take it away and you can put it first. Mr. Macune is a smoker and drinks excessively. He has been suffering. So you can make it this way as well. There is no compulsion, no ratta, no mug up. So my son is a chronic smoker, drinks excessively. He has been suffering from asthma since 1998. He is on medications. So write only important thing, due to which he became cautious. Now the last line, today. So today he visited community health center for checkup. So this is the first time he is visiting. Therefore, he visited. If you want to write therefore over here, if you don't want to write even then it's fine. So today he has presented. So you simply say, just write today he has presented. He has presented. Now this is the first past, and see everything was in the past. Second form, second form, second form, got, second form, was unable, had, second form, again took second form. But as soon as today came, I said present perfect. Today he has presented. Today he has presented for checkup, assessed and history. He has presented and checkup has been done. That is the passive voice. So active, he has presented by himself. Passive, checkup has been done and history has been collected. This is what that takes you to the next level of marks. This is what takes you to 390 or 400. Because now examiner understand that you know what past is, you know what present is, you know what passive voice is. Checkup has been done by us, history has been collected. So this is what you need to learn. So I will write it. Active, second form. Passive was plus third form in the past. This is the chart you need to remember always in OET. Today visit has plus third form. Active, passive voice has been third form. That is the only chart you need to remember. Active, passive. So this is past. Always write it in the start. And this is today. That is present perfect. This is the only thing you need to remember. Always write it on the question paper. When you will get your question paper, you will read it, and as soon as you are allowed to pick up the pencil after 5 minutes, the first thing you should do is this. Past, active, second form, passive was plus third form, today has plus third form active, has been third form passive. That's it. So this is what gives you marks, the control of grammar. This is what gives you marks. Again, I'm telling you, grammar. This is what gives you marks. Simple. Simplest of the letters. That is why it is such a simple test. Assess history, contact. Now, also further, he has reported. Now, this is the way to write. The patient always reports. Further, he has reported that he has been in contact with Chinese tourists recently, and his symptoms recently. Sorry, recently. Yeah. And his symptoms are also suggestive of COVID-19. Therefore, your expertise is urgently required. Or you can say that your expertise would be highly appreciated. Sorry, your expertise would be highly, therefore, your expertise is highly required. Sorry, that is not looking nice. Otherwise, is highly required and would be highly appreciated. That's it. Letter is all over. That's what OET takes. So the things I wanted to teach you in this letter, that sometimes even after giving dates, it might not be a visit letter. When you are confused, even if it is a visit, suppose you say, sir, this is a visit. I will say, okay, even if it is a visit, then also it's right. On 9th March, he suffered from deathlessness. After 2 days, his fever got settled. Yesterday, his fever got to 103. Even then, it is fine. So this format helps you to do both visit letter as well as normal letters and keeps you safe. And if by chance you say, sir, what I did this like this. I made 5 paragraphs. I made 5 paragraphs like this. I will say perfect, no problem at all. OET, it should be just nice. That's the only thing they want from you. Such simple, such nice. Overall time maximum 25 minutes. That's it, maximum. After talking to you, discussing with you, typing, even being medical professionals, overall only and only 25 minutes. That's what it takes to write the complete letter. That's it. That's it. This is Dr. Bhupesh from Dr. BKM OET Institutes. Our number is 76967342256. Please subscribe our channel if you have not. Please listen to this video again. Learn tenses, learn grammar, and be on the top of OET and conquer this test with complete ease. Thank you very much.